It's a new year, but with the same old medical tyranny in British Columbia as the province continues to restrict thousands of healthcare workers from saving lives due to their vaccination status. The question is, why? Drea Humphrey here with Rebel News, and the fact that British Columbia's public health officer, Dr. Bonnie Henry, is still hanging on to draconian COVID-19 mandates that prevent thousands of healthy medical professionals from saving lives, despite the province's crumbling healthcare system, shouldn't be all too surprising. In fact, in July 2021, just a few months before the province laid off close to then 6,000 healthcare workers for not complying with COVID-19 jab mandates, the unelected health lord made it crystal clear. She can barely tolerate a frontline hero if they dare to make a different medical choice than she does.
I have very little patience for people who aren't immunized in healthcare.
Well, Dr. Henry may enjoy that her handsome tax-paid-for salary allows her to use the unelected power that's been bestowed upon her to hold powerful grudges should she choose to. The likely motive behind why elected officials such as BC's Minister of Health Adrian Dix and Premier David Eby are still allowing the punishment of unvaccinated frontline healthcare workers is less clear. After all, they are certainly aware of how regular ER closures and deadly delays in care have been bringing BC's healthcare system to its knees, especially over 2022. The True North article you just saw on the screen was about a 8-month-old baby who died of cardiac arrest outside of Kamloops while waiting too long for an ambulance.
You could see that he's already turned the color and everything, and I tried to help, but there was nothing I could have done for him.
President of Ambulance Paramedic of BC, Troy Clifford, said they were aware of instances where people have had serious issues and have died because the ambulance wasn't there in other communities.
Good evening. Thanks for joining us. It's being described as the worst case scenario. A baby has died in a small BC community, and when the parents called for help, the town had no ambulance. The paramedics union says the heartbreaking situation is a result of chronic staffing shortages facing BC's health sector.
According to CTV, he also said that the ambulance that would typically have been serving the district where the baby was in Kamloops instead, helping to cover a staff shortage there.
On this night, what I understand happened is that they were so short-staffed in ambulances in Kamloops that they pulled them into Kamloops for cross-coverage. That's absolutely tragic in this situation that we didn't have an ambulance available for somebody in their time of need.
Yet, despite such gaps in coverage, I previously reported to you that a group of close to 60 vaccine-free BC paramedics, keep in mind that paramedics have to work in at least twos, are actually preparing to take legal action to fight in order to be allowed to go back to work and back to saving lives of British Columbians. How do BC's public forces sleep at night, keeping these mandates in place? Not to mention how hard it is to wrap your head around what on earth the science, or political science for that matter, these politicians are relying on to banish life-saving heroes from our short-staffed healthcare system. I've done too many reports to count on how, jabbed or no jabbed, anyone can catch and spread this common COVID-19 virus. In fact, thanks to the Freedom of Information request done by former ER nurse Corinne Morey, who would rather be saving lives than having me talk about why she can't do so in reports like this, it's been revealed that there were tens of thousands of sick COVID-19 calls from medical professionals that were at least double vaccinated after healthcare workers like her were booted out of the system. But just to really highlight BC's obsession with hanging on to these illogical COVID-19 mandates, which most of the world has come to their senses about, let me give you an example of the types of pleas to care BC's frontline heroes have been making on behalf of citizens whose lives may depend on them coming back to work, yet unfortunately have been falling on deaf ears. I'll just read a bit of this letter written and sent by all of the nurses and physicians in the perinatal program of the small city of Port Alberni's West Coast General Hospital. The letter is in response to the loss of their beloved Dr. Christopher McAllister's services due to tyrannical vaccine mandates. I first introduced you to Dr. McAllister after our friends at the Democracy Fund decided to take on his ongoing legal fight at no cost to him as he fights to maintain his license while the hospital authority tries to take it away due to him not being able to work in the hospital. The letter reads, "Please receive this petition as a request to reconsider the COVID vaccine mandate required for all healthcare and allied workers who provide care in British Columbia's acute care services. West Coast General Hospital is a community hospital that experienced challenging repercussions to its prenatal and pediatric services due to the vaccine mandate. Dr. Chris McAllister is an incredibly skilled and knowledgeable physician. He goes above and beyond for his patients, their families, and the colleagues he works alongside. He is a genuine caregiver and a pillar of our community. The impacts of losing 50% of our pediatric coverage have been devastating to our perinatal and pediatric programs at West Coast General Hospital. At times, our hospital has no pediatric coverage. This has led to the diversion of expecting mothers, acutely ill babies, and pediatric patients away from their families and personal support networks." Can you believe that? Now, I'll put the full letter, which you can read and should read below in the description in the article, but Dr. McAllister's legal fight is far from over. The latest update I have for you is that he is waiting on the hospital's appeal board decision for the hearing of the state application that took place mid-December. So please, if any of this resonates with you, you can open up another screen, another tab, and go to our special website called saveourdoctors.ca to help chip in for his legal expenses. Now, Dr. McAllister says that his community, his friends, his colleagues coming together to bat for him this way was extremely touching to him. Yet, apparently, the political forces preventing him from saving and caring for expecting moms and sick kids were not touched enough, since I don't see their New Year's resolution being to end medical madness in BC by ending the inhumane vaccine mandates. And according to some of the hospital staff who signed the letter, it wasn't just sent to Dr. Bonnie Henry and Adrian Dix. No, it was also a plea sent to BC's new leader, Premier David Eby, so fearless that instead of doing the logical and moral thing by stopping the punishment of unjabbed healthcare workers and the patients they could be caring for, he's continuing to support it. And in fact, he's deflecting from it. Just take a look at this tweet. "A law passed by the previous government led to the largest mass firing in BC history. These vulnerable healthcare workers were then asked to reapply for the jobs they already had, but with half the pay. We changed that, and I'm incredibly proud of the work our team has done." Now, I know what you're thinking. Largest mass firing in history? Does that mean the province decided to let the vaccine-free public servants, medical professionals, and paramedics back to work? Did BC's NDP government finally get a grip and drop the vaccine mandates to effectively address our healthcare crisis? Except no. Of course, he's not addressing that elephant in the room here. Instead, after that Port Alberni Hospital's letter was sent, he's referring to the one-year anniversary of the repealing of the BC Liberals' privatization of food housekeeping healthcare workers, which meant approximately 4,000 of such workers were back to work with fair wages. If they were vaccinated, of course. Now, it's no wonder activists are trying to canvass the Point Grey area in Vancouver to try to have Eby's MLA seat recalled. Two wrongs don't make a right, Eby. All hospital workers are essential, especially ones who are trained to save the lives of sick babies, like the one whose little heart failed waiting for an understaffed ambulance system that your government is contributing to with their coercive, discriminatory, heartless mandates. Drea Humphrey for Rebel News. If you appreciate the great words that were said about Dr. McAllister and the service he's done for British Columbians, consider chipping in a few bucks to help cover the costs of his legal expenses. If you go to our special website at saveourdoctors.ca, you can chip in and do a tax-deductible donation to the Democracy Fund. Not a penny goes to Rebel News. It goes to help covering his legal expenses so he doesn't have to worry about the finances for them.